Good morning, ladies and gentlemen. Welcome to the first TPD think tank symposium located at the SEED headquarters, King of Prussia. I solved the first E3 ligase structure, E6AP, in 1999. And with Ning Zheng, actually, we were lab mates at the Memorial Sloan Kettering Cancer Center. So it's really a long time in the making for all of us to be here. Very importantly, we like this platform to be a more interactive platform and to exchange ideas and also to think about the challenges and opportunities in TPD field and how we can translate the TPD platforms into medicine for patients with unmet medical needs. It's an immense pleasure and honor to welcome all of you to come to this event. And I think the audience is just as distinguished as the speakers who are the thought leaders and pioneers in this TPD field. So let's make this platform, let's make this a celebration, and let's make this the think tank to continue for the future. Thank you.
I also think that my story shows that basic research can lead to translation to the bedside. What I did all my life, and even when now, is mostly basic research, trying to find out how things work. You see now today's symposium on molecular glues and how we can approach this important issue.
We're in a unique position to kind of redefine molecular glue. We think molecular glues are very unique chemical inducers of proximity, different from PROTAC, by not showing affinity to at least one of the protein components of the system. And second is molecular glues action relies on the basal interaction in micromolar range between the substrate and E3 ligase. And the glue's job is to push this interaction into nanomolar range. In other words, you convert non-productive weak protein-protein interaction into productive, strong interaction.
So this is the first PK/PD study in ACT116, the colorectal cancer model. We got a nice dose response, and you can see on the PK side, when you lost efficacy, you had a big drop in the blood concentration, which is very informative to us, allows us to say at 10 mg per kg is the target PK level. Cmin was 289, Cmax 9857.
My laboratory has matched about 40 substrates ubiquitin ligase pairs. And we start in general from proteomics and somatic cell genetic studies to identify the initial hits. And then, of course, we validate them in cell system as well as in animal models.
We try to focus using the cross-linking mass spectrometry. And the cross-linking mass spectrometry actually is a mass spec-based structure tool for studying native protein interactions. It can capture the interactions through the formation of a covalent bond between proximal amino acids. And this proximity is defined by a specific cross-linker. And this cross-linker is composed of two reactive groups. And then in between is connected by a spacer region. So typically, this region is 7 to 15 angstrom. So the distance between the amino acids actually is much shorter compared to proximity labeling. And there are different reactive groups can be added and to form the covalent bonds between the protein interactors.
And here, this is a result that I did remember discussing with James, because when I heard him speak about the methodology of looking at basal interactions, so to speak, these non-productive interactions, I thought this was very reminiscent to me of what we had seen. So for instance, in this case, we started from a crystal structure that we had determined for ACBA1, for a specific potent degrader. We removed the degrader, so we only had the proteins by themselves. And then we said, how could these proteins interact? So we look at, you can generate multiple poses using AlphaFold, multimer, your method of choice, docking, however you want. But we did that, and then we ran sufficient molecular dynamics from these starting points to be able to create a more global map.
With SEED, we developed this in vitro assay using cell lysate. And Avram has a little bit talked about lysates as a way to use ubiquitin reaction. So we took our ASPC cell line, we did the lysate preparation, and then in lysate, so this is all with endogenous component, we add the products, and then we add a ubiquitin mix consisting of E1, a couple of E2s, some DAB inhibitor, flag ubiquitin, and a system to regenerate ATP. And so this was the result. So when we treat this lysate with the KEAP1 product at 0, 10, 100 micromolar, nothing really happened. So we don't see any ubiquitination of KRAS. When we treat with the VHL product, we start to see some ubiquitination at 10 micromolar, a little bit stronger at 100 micromolar. However, when we mix these two, the KEAP1 and the VHL, at 10 micromolar, we see a much stronger ubiquitination. So compare this versus this versus this, which suggests that the two products are synergizing in ubiquitinating the target.
As Ning mentioned, we are standing here on the shoulder of giants, and she's sitting there. And our work was inspired by our first structure, and sometimes I look back at the structure. This is 2000. I mean, you can say it was not complete, but if you look at and project it back there, it was a monumental work, and so very inspiring.
I hope you enjoyed the conference as much as I do, with all the exciting and thought-provoking talks. As you see today from Seed's talk regarding the RBM39 NCE degrader, I think if the company do it right, we could speed up the drug development in a meaningful way to IND and then potentially NDA. Truly, I think it's an ecosystem, and we need everybody here to move the field forward and really have the sky as the limit. Thank you.